What's up, guys? Holding your H-Bomb Fitness. Today I'm going to walk you through a calf complex, okay? Just 2 or 3 exercises that you can do for your calf, okay? So these are great because pretty much society, we're all lacking dorsiflexion, okay? This comes through wearing shoes, walking on flat level surfaces. When we walk on that, like on concrete, our foot muscles and our range of motion decreases because there's no need to use that because the surface is flat, opposed to walking in sand, gravel, jumping on rocks. You know, your feet have to adapt and go through all these ranges of motion. So we're going to combat that. Okay, so you need 2 peanuts, okay, a crossballs preferably. And what you're going to do is place these peanuts pretty much right where your knee is, okay? And basically, if you see this from the side, you are just gonna put all your pressure through your knees, okay? So you can be in the bottom of a squat like this, kind of work on that dorsiflexion, ankle range of motion too, or you can just kind of overload it and put all your weight throughout your body on it. Doesn't really matter where. We're not really trying to focus on ankle range of motion. We're just trying to work on the gastroc, even though that will help with it. Okay, so what this is also doing is we're getting a little flexion gapping, they call it, within your knee. So if you think of your knee when you're doing this, I put a space in between it. It's actually creating a little bit of gapping, and it's kind of like a joint mobilization, which is good. We get some of that fluid moving throughout there. Get those surfaces kind of rubbing against each other and taking a break from each other. So that's actually a PT technique, is that flexion gapping. So we're getting some of that, but the main thing we're getting is this high gastroc head, okay? Not so much the soleus here, but the gastroc. And we're getting the high portion of it. Usually when we do a lot of the other stuff, we're getting the middle and lower ends of the gastroc. Here we're almost up into that femur where it attaches, okay, to the condyles, okay. So the key here is just to relax, work around with it, okay. Put all your weight forward, get a squat, and this thing's nice because you can just camp out. I'm just letting my body weight do all of it. It's not very painful, which is great. If it was really painful, that wouldn't be a fun exercise. This is mild. You just gotta work it. You can go right, left, all that stuff. Okay? So you got that. Alright, other exercise, a little more unconventional, is a barbell calf smash. This is something that I came up with, actually. So what you do is you need about 2 weight plates right there. Okay, and then put some type of padding on top of it. Okay, and then you need a barbell with, you know, you can put 5 10s on each side, but nothing really more than that because that's pretty intense. So what you're gonna do is you take the barbell, okay, and you want to make sure it's level, and you just place that thing right on your calves. Okay. And so what you want to do here is just relax. And so what you can do is you can kind of go into plantar flexion with your feet. You can go dorsiflexion. You can just kind of do little contractions here. But what's really important here is just to relax. Okay, you got a lot of weight on your calves, and you just want it to sink through. This is probably the most intense deep tissue massage you'll ever get. Okay, and nice thing about this is with your hands, when you do find a spot that you just want to hold on to, you can kind of plant your hands down, and that prevents the barbell from sliding back. Okay, and so that's nice. Instead of just letting it roll, which can be really painful, you can find a spot, kind of plant your arms, and use your arms to hold it in place. And so here you just want to relax, get into a comfortable position, and you'll feel this one a lot, and you'll feel it just sink in. This is a great exercise. It's probably my top 3 exercises of everything I've ever shown. This thing just lets you sink in, and it does wonders. You know, think about if you had like a massage therapist or a PT just digging in their elbow into this. So that's that. Okay. Want to be careful with putting it back down. Okay. And the last thing, got a calf board over here. Okay. Oh, I'm still tight. You just want to load up on here. Okay. Make sure you are contracting or extending your knee. Okay. I mean, if you do it like this, that's more soleus, but we want to really contract our butt, our knee, and just load our weight into it. Okay. Switch sides. Alright, so there you go, guys. If you work on those 3 things, your dorsiflexion will be superb. Alright, so there you go, guys. See you.